The representative and prototype medication in potassium-sparing diuretic is spironolactone. We have discussed spironolactone in an earlier lecture. Spironolactone is categorized as both potassium-sparing diuretic and aldosterone receptor antagonist. By antagonizing the aldosterone receptors at the collecting tubule ducts, spironolactone produces diuresis along with excretion of sodium. At the same time, it retains potassium. Therefore, therapeutically, spironolactone belongs to the class of diuretics. Spironolactone is a synthetic steroid antagonist, which work directly at the intracellular level to inactivate the spironolactone receptor complex. Following the inactivation is inhibition of sodium channels and sodium-potassium adenosine triphosphatase pumps at both epithelial and intracellular levels, which then leads to the therapeutic effects of excretion of sodium, diuresis, and retention of potassium. Blood pressure is lowered, and cardiac preload is then decreased. Spironolactone is a drug of choice for hepatic cirrhosis. It is used for edema, commonly used together with thiazides. As a hormonal antagonist, it is used to treat hyperaldosteronism. As a diuretic, it is used for edema caused by hepatic cirrhosis and heart failure. Resulting from its therapeutic effects, spironolactone is also used for resistant hypertension, diuretic-induced hypokalemia, and polycystic ovary syndrome. The outstanding adverse effect of spironolactone comes from its non-specific hormonal antagonizing influence. The hormonal adverse effects include an inability to maintain erection and gynecomastia in male patients, and menstrual irregularities in female clients. Being a diuretic, spironolactone also puts the client at risk for metabolic side effects, especially electrolyte and fluid imbalances. Hyperkalemia is the worst adverse effect when using spironolactone. Hyperkalemia usually occurs when the client is taking a high-dose spironolactone or using spironolactone with other medications that alter potassium level. Spironolactone works on the hormonal part of RAS. Spironolactone is contraindicated during pregnancy and for breastfeeding. And let's emphasize here again that spironolactone puts the client at risk for metabolic adverse effects. Therefore, it is used with caution on patients who have renal impairment or fluid and electrolyte imbalances. It is also used with precaution if it is combined with other medications to treat hypertension because of the adding therapeutic effects and higher risk for adverse effects. Knowledge is power. We should always empower our clients with patient education. Teach client the adverse effects and how to manage the adverse effects. Diuretics are antihypertensives. Monitoring blood pressure and heart rate before administering medication should become a habit for both patient and nurse who is giving the medication. Teach the client to monitor blood pressure and heart rate regularly. Teach the client prevention of orthostatic hypotension and safety measure. For example, do not operate machineries when first initiate the medication until the body adapts to the medication. Also, change position slowly can help preventing fall due to orthostatic hypotension. Spironolactone is both potassium-sparing diuretics as well as an aldosterone receptor antagonist. Its steroid effect could lead to sexual hormonal effects, which should inform the patient possible breast tenderness and enlargement. Teach the client to take tablets in the morning. If taking diuretics late in the evening, patient may experience inconvenient nocturnal urination. Teach the client to avoid excessive potassium intake. Avoid using salt substitutes or high potassium diet. Monitor potassium level and kidney function. Monitor elderly clients more closely because they are more susceptible to fluid and electrolyte imbalances. Teach the female client to report pregnancy. Spironolactone can injure the developing fetus. A new prescription for managing blood pressure is needed. Teach the client to call 911 if experiencing symptoms of heart attack. Although I emphasize patient education in nursing care throughout all of my lectures, it does not mean that we are off the duty for providing all of this care that we preach. I wish that we have the consensus that as an RN, we will also do what we teach to our clients. Precautions for drug-to-drug, drug-to-herb, and drug-to-food interactions should be taken when patient is on spironolactone. ACE inhibitors and ARBs add up the side effects of hyperkalemia and hypotension of spironolactone. Acetylsalicylic acid may decrease the therapeutic effects of spironolactone. Aspirin and other salicylates decrease production of renal prostaglandins. Therefore, they reduce renal blood flow. As a result, NSAIDs can decrease the effect of spironolactone. When using spironolactone with an anticoagulant, we should know that the anticoagulation effect would be decreased. Low molecular weight heparin puts the client at risk for hyperkalemia. Cholestyramine puts the client at risk for both hyperkalemia and metabolic acidosis. Spironolactone can affect the renal clearance of digoxin and lithium, leading to toxicity of these two medications. Licorice blocks ulcer healing and increases risk of hypokalemia. Potassium-rich diet, such as salt substitute, citrus fruits, and tomatoes, increases risk for hyperkalemia, just like potassium supplement can do to spironolactone. One particular emphasis here is that laboratory results can be interfered by spironolactone. Spironolactone increases BUN and potassium levels, and it decreases sodium level and granulocytes. Nursing care to prevent these interactions includes helping patients to establish a medication list and monitoring the electrolyte status and renal function. Thank you for taking this lecture with me. I look forward to seeing you soon.